Good afternoon, everybody, and welcome to this week's Power Hour. Today, we're going to talk about practice management and hear from a few practices how they're coping in this world where we are still dealing with COVID-19. And we have, as guests today, we have Amanda McKinney, we have Naomi Simon, we have Cindy Knox, and we have Michael Buncher. And these, our guests are from they are practice administrators as well as practice owners. So we're going to hear their thoughts and experience from what they've gone through and what they're facing right now. So just as a reminder, we started Power Hour as a response to COVID-19 in a really tricky time when we all had to keep separate and basically our reality completely changed. And we did that in order to focus on conversation, collaboration, and community. And we keep having these weekly Power Hours, and Franklin reminded me that this is actually our week 11, and we have been talking around about a lot of different topics, and you can always access the recordings from prior Power Hour sessions on the KIPL Institute for Physicians Leadership landing page. We also invite participants to participate, so if you do have a question, please feel free to unmute and engage with the guests, or you can also post a question in the chat box and we will get to that as there's a flow in the conversation. But other than that, I would like to hand it over to my colleague, Franklin Walker, who is, as always, the moderator for these sessions. Franklin?
Thanks, Tina, and thanks for that background. Welcome, everybody. As Tina said, we're now in week 11 of our journey that started, I think, back in March or April. And want to send a welcome to my guest panelists today, Michael Buncher, who is a practice administrator up in Hendersonville, North Carolina, Amanda McKinney, practice administrator in Hickory, and finally Cindy Knox, practice administrator in Morehead City. And you know, we want to hear how COVID has affected you guys. So we know that it's been almost devastating to a lot of practices out there. Their patient flow has been particularly impinged, maybe 40 to 80%. You've got shortages of PPE, and your staff, I'm sure, is concerned about being on the front lines and possibly getting infected and maybe infecting their loved ones. So there's a lot that we can get into. But my first question for the panel is, as we started to see this happen in February and March, and, you know, we're all in healthcare and you guys are on the front lines, I want you to talk a little bit about the steps that you took as you saw this happening. So tell the audience about your steps, and then I want you to reflect a little bit back on where we are now and compare it to what you could have done early on. So, Michael, I'm going to ask you to take that one on first, please, sir.
Okay, well, great, and thank you very much for this invitation. It's a pleasure to be here. So it was the third week of March that we really started to feel and see the direct impact of COVID. Up to that point, we knew it was coming, and there were forewarnings, but the third week is where we saw volume and other implications really at our doorstep. By week 4, we had tents up. We had figured out quickly as a primary care provider that it was our commitment to stay open, that we needed to do that for our community, the community of kids and families. And so principle number 1 was stay open at all costs. And that meant that number 2, the only way we were going to get people into our building is if we made it as safe as possible and could demonstrate to our families and to our staff that it was safe to come to work and come to have medical care. So probably the very first call I made was to housekeeping. And I doubled the regimen and therefore the expense of the housekeeping requirements, including the wiping down and the disinfecting of all surfaces. We had tents up by week 4 of March out front. It took us 2 weeks to kind of work out the clunkiness of it. We lost one tent to a storm and had to replace it right away. But the intention of that tent was to begin screening people for temperature and at the time there were 3 questions that we were asking everyone. And anyone who is symptomatic or showing a temperature or answering yes to any of the screening questions did not come in the building. And so we implemented that right away, and that seemed to bring the shoulders down, so to speak, the anxiety level down of staff and families who were seeking care. By the first week of April, we had made another strategic move. We realized that volumes were going to drop dramatically, and we created Clinical Team A and Clinical Team B. And we had these teams were formed and worked 3 consecutive days and then off 4. We decided there was no such thing as weekends because it didn't matter. People were in stay-home orders, and they were going to be home middle of the week just like they were a weekend. And so we had teams working Sunday through Tuesday in one practice and Wednesday through Saturday. And then in the other location, we had them working Sunday through Tuesday and then Wednesday through Saturday. So there was other strategy behind the 3-day work and 4-day off, which was at the time, and we still believe this, that most adults will show symptoms within 4 days of exposure if they're going to show symptoms. And that was actually our 4-day quarantine that we just built into our schedule. Fortunately, we've not had any staff that have tested positive, but we did have somewhat early on, we had 2 staff that were symptomatic and were sent for tests, and we did have to do the tracing, and we did have to have some folks stay home for a period of time till those results did come back negative. We then, by the 3rd week of April, we split the office physically in 2, and we had a sick side and a well side. And this, to this day, we're still operating that way. We have a wonderful, local fix-it guy, our kind of our facility manager. We called him, and he put in some 2x4 framing and some plastic sheeting, and we explored our HVA system more deeply and made a few modifications there, and literally created side A, side B in each of our 2 offices. All of this was with intention to protect our employees and our families that we were serving. And so all the while we were beefing up our messaging through our social media, web page, Facebook page, and direct messaging to families to try to keep them up to date on what we were doing, why we were doing it, and to encourage them, therefore, to still seek services and feel like they could be safe. That was a challenge because volumes really dropped. People just weren't going to leave their home. They weren't going to bring their newborn in or their 2-year-old in for, a well child check. Just wasn't going to happen. And we understood why. But now they seem to be much more comfortable in that. So the next challenge after that was really financial. And I make it sound like it was sequential, but a lot of these were, all happening in parallel. We, besides delivering medical care, we're a small business. We knew we wouldn't be doing anybody any good if we, had our best intention, but went bankrupt in the process. And so we immediately did a detailed review of our finances down to the vendor level. We were on the early curve of the PPP loan and fortunately got one, and that's been very helpful. We negotiated everything from, rent delay payments to other ways of stretching our pennies. Those new schedules that we had developed with 3 days on, 4 days off meant that staff hours were reduced from typically 32 to 35 hours a week down to 24. And so on top of everything else, we had to coach and learn and guide people into the North Carolina unemployment process. And we made it our best intention, our commitment to try to help everybody whose hours were reduced to properly enroll and learn how to navigate the unemployment system. And that's been a challenge. At that time, there was no $600 a week flowing. And so But it was only, I think, 2-week period before our PPP loan kicked in, maybe 3 weeks. So it was relatively short time that folks were without their normal rate of pay and normal pre-COVID hours. And we've enjoyed that for the last 8 weeks, and we're just coming off of it now. And really, it's quite difficult now. Our volume is picking up. Folks, we have hours for people to work, and they're not all, but there are a handful who became what I would call a little intoxicated by the $600 a week, and they would rather keep their hours down rather than up because that's a nice little bump in pay. Mm-hmm. I'm actually happy that that benefit goes away July 31st, and I hope that if it is replaced, that it's replaced with something more thoughtful, because that's really been a little bit of a backward incentive for people returning to work. I think, the other thing I'll say is that telemed, we were focusing on patient care delivery. Telemed, like so many other practices, has become a substantial part of the way we deliver care. We've always maintained well visits in the morning. We will not do well visits over telemed. It's not, in our doctor's opinion, a viable way to deliver well child checks. So our doors are open, and we're doing well visits in the morning. In the afternoons, we have one doctor on doing on-site visits, meaning patients arriving, and the other doctor is doing telemed, and they are booked solid. So any of us who've done telemed know that that took on a new learning curve, not just the technology and working out new flows with families, but also the billing. And that was a challenge for several weeks, but we are now stabilized that, and we are enjoying good, timely payment for those telemed encounters, which has made a huge difference in a positive way. So I think I'll pause there, unless, Franklin, you think there's anything more you need from me. Let's someone else.
No, I think that's a great way to comprehensively answer that first question, and I thank you for all that detail. Amanda, can you give us some insights on what's going on with your practice in terms of the preparation for COVID, and then what you might look back on and do differently?
Sure. So much like what Michael described, we really got hit full force with this about the third week of March. We knew it was coming. We were kind of watching the numbers, seeing what was going to happen. But we had a plan in place. We knew that when the first case was diagnosed within our county, that was when everything would immediately do a 180, and that's what happened. We have OB/GYN and primary care, and all the departments had to respond in a different way. So that was a little bit different. Immediately what we did is we stopped all non-essential appointments. Of course, babies don't stop, so we had to rearrange our OB appointments and work on how to condense those appointments as much as possible, which we did. We ended up combining new OB appointments to limit the number of times that a new mom was coming into the office. We were able to, any of our OB patients that were stable, we were able to stretch out their appointments. On the GYN side, we stopped all non-essential appointments. We only saw immediate problems. And on the primary care side, we immediately jumped into telehealth, as Michael talked about. We looked at a couple of different options, but we were able to get that up and going very quickly. And that was very helpful. So again, we stopped all non-essential, no annual visits. It was really just follow-up and problem visits. And so that's how we kind of managed all three departments in different ways. We try to do telehealth as much as possible, but primary care is where we really see the success in that. We started checking temps at the front door, screening patients before they came in. Also, as mentioned, we beefed up our communications via social media on our website. We were sending out automatic calls to patients just to alert them to the new screening process. As far as testing goes, it was a little different in the beginning. We first started off testing. Then as the CDC guidelines sort of morphed and started advising that asymptomatic patients should just stay home and self-quarantine or mildly symptomatic, that's how we started advising our patients. So there was a period of time for several weeks where we hardly brought anybody in for testing. And then that changed again, and now we're, I guess as testing supplies have become more abundant, we're testing regularly. And so we had to set up a protocol for how that was going to happen. Essentially what we finally settled into was we are setting up those appointments as telehealth, triaging them via telehealth, and then bringing them in through to our back door where we swab them in the car. And if a patient looks like they need further assessment, we have 2 sick rooms that were assigned at the back side of our practice, coming through the back door, so you're not really exposing any other area of the office. And those are our sick rooms. We're able to keep that sectioned off from the rest of the practice. As far as staff goes, the first 2 weeks, or those last 2 weeks of March, we did start rotating our staff out. Once we got past those 2 weeks, we saw we were really going to have to clamp down a lot. Like Michael mentioned also, the expense portion of it was really simultaneous. We started reaching out to vendors, reaching out to our landlord, anything we could possibly put off or stop for a while, we did that. And with our staff, we were rotating them 1 week on, 1 week off. We had a total of 15 people furloughed, including 3 providers. So that helped on the expense side. It meant double work, of course, for the people who were here when they were working, but everybody really pulled together and made it happen. We actually brought everyone back the week of May 4th, and we have slowly ramped up ever since then. So that's been a real blessing. Trying to think if there's anything else I might be missing just as far as the early days go. There certainly is a lot of lessons that were learned in this, and I'm certain there'll be more, because we do continue to see more positives. We've had an employee positive. We've had several employees that have been exposed and had to be tested. And so those are all stepping stones to learning more. I could say from a financial perspective, it was extremely important to recognize having a nest egg. Often we hear that you need 3 months tucked away just in case. This is a perfect example of that. And so I won't say we've always done a great job with that, but I feel pretty positive we will going forward.
Super. Thank you. And finally, or not finally, Cindy, I want to give you an opportunity to tag on to what Michael and Amanda have said. And like Amanda, you have an OB practice down in Morehead City, so maybe there's some different things that the geography brings to you that's not to the other 2.
Well, we followed a lot of the steps that Amanda and Michael have done. We set up a sick tent in the back of our building. We did not see any sick patients in the office at all. We screened them on the phone. We currently still check in all of our patients from their cars, so no one comes into the building until they're ready to be seen by the provider. Their workup is done over the phone until they actually have to come in and be put into the exam room. We initially set up a COVID team so that we had a physician champion, the clinical manager, myself, and every morning we would come in. We would look at workflows, we would look at current situations, we'd make plans, and it would change throughout the day. It was very fluid. We furloughed over 25 employees throughout the practice, which included physicians. We had a physician that went out on FMLA. And then we had all of our nurse practitioners rotated every 4th week. We limited the number of staff in the building. Any admin staff could work from home. They worked from home. Everyone's hours were reduced to 30 hours. All the physicians that were working went without pay for at least 2 pay periods. which was very difficult because they were working extremely hard during this time. But since we came back June 1st and we brought everybody back, we have the same attitude in our furloughed staff that I think Mr. Michael's talking about, was the attitude of, why did I come back now? I could have stayed home. I could have got my extra $600. I'm making less money now. So we're having right now to deal with those attitudes, and it really has affected morale. So today we did I tried trying to do some crazy things. So one day we did ice cream. Today we did salt and sweet day, bringing candy and chips and stuff in, just trying to change things up a little bit as far as morale goes for staff. But our physicians are tired. They're extremely tired. They're exhausted. Our patients are angry. They're really angry, and they're taking it out on our staff, and they're taking it out on our physicians. We've had to turn off all of our reminder calls because we don't have appointments available for patients calling in right this moment, because we're trying to play catch up for the 2 months where we reduced and did not see any well woman exams and did not see any mammograms. So our whole way of the process of checking in patients, working them up, has changed, and I don't foresee that changing right now, especially in Carteret County, with no one is doing social distancing hardly here. The beaches are full. Our numbers are increasing. We've had several physicians had to be tested and taken out of work during that 2-month period of time, which was very difficult on everyone. They luckily were not positive, but we continue to have staff that comes in and says states that they've been exposed, and then we have to figure if we're going to take them out of work and how we're going to cover them. We do require all of our staff and physicians and patients to wear masks when they enter the building. We're requiring social distancing between our staff and our providers, which has been different because they're usually sitting side by side with each person, with their providers. Breaking up our lunch area so that they have to sit outside or in different areas or sit in their offices to have lunch. They're not allowed to sit together. It really has changed the dynamics of the practice. We constantly keep looking at those workflows every day, looking to see how we have to change it, how it's working, what's not working, and keeping that line of communication open between the whole staff. Luckily, I've had Amanda and several other managers that we are in a small group. We would bounce information back and forth between everybody and utilize their knowledge and experience to help make changes within our practice on a day-to-day basis. So I'm very blessed to be a part of that group that Amanda's in, because very smart people in that group.
Super. Thank you, Cindy. I want to welcome Dr. Naomi Simon to our group. Dr. Simon was, I think, seeing some patients, so she was finally able to join us. And so, are you there, Dr. Simon?
Yep. Hi, how are you?
We're well. Thank you for joining us. Dr. Simon is a dermatologist in Mooresville, North Carolina, and so you're the only physician owner specialty practice to join us today. The other folks are primary care and are, as you know, located in different parts of the state. So the question that I had posed, Dr. Simon, to our other panelists was, what steps did you take as a practice to prepare for COVID? And you heard some of the answers when you came on. And then looking back, maybe what are some of the things that you might have missed and that you would do now? So please take a whack at that.
Wow, it really feels like a bomb drop, doesn't it?
It did.
So back in March,
Yeah.
it's crazy. Back in March, like the second week of March, I was supposed to go on spring break, and we just had a bad feeling, so I canceled the whole trip. That was the week of the 16th through 19th, and came in that week, because at that point we didn't know if we were going to have to close everything or what was going to happen. So we took all of our melanoma patients and squamous cell patients and moved their surgeries up to that week, and I just came in and did surgery all week. So we knew we could get like the really more urgent people done before we, who knows what was going to happen. then we kept working the next week, but we basically like took everybody off the schedule except for we became an urgent care derm office, essentially. So we would see infections, cellulitis, really bad rashes, and we continued to treat some skin cancers, but it was very confusing because the American Academy of Dermatology and a bunch of derms around the country were coming out with statements saying, oh, you can push melanoma surgeries off for 3 months if you need to. You can push squamous cells off for longer. And we were like, we don't have a huge caseload here, and that seems kind of dangerous to us. So we don't want to do that. So we basically had to figure out what we were comfortable with and do that. And we felt like we wanted to keep seeing skin cancer patients. But we, for the entire rest of March and April, we only saw urgent cases if they were 65 and older. Everyone else we told 65 and older just don't come in. We sent 1,500 letters to cancel all preventative screenings. And we then, throughout the month of April, furloughed all 3 of our PAs, 20 of our staff, and only my partner and I saw patients alternating every other week. So I did telehealth visits only from home on the weeks that I wasn't in office, and we only saw about 12 people a day, which is down from 125 a day. So then that was all of April. Starting in May, we started to bring back our people with 5 or more history of skin cancers or atypical moles, 5 or more. So we just picked that number out of a hat, like who's going to be the most urgent to start seeing again. And part of this also had to do with the fact that Iredell County barely had any cases. So we felt like we were balancing risk of not seeing people for screening again. We kept doing skin cancer surgeries. We kept doing urgent care derm, rashes, cellulitis, infections, but we also added back the high-risk patients. So that was all of May. We brought back a team of people who volunteered. And the other part that was kind of weird was when at the very beginning, we asked people like who would volunteer to work and not go on furlough, because everyone who was going on furlough was going to make more money on furlough. And that was one of the hard things. So the people who volunteered, we took them. There were several people who wanted to stay home and were just scared, staff-wise. And so they stayed home. And then over May, we brought back like a couple more. But then toward the middle of May, this had been like 8 weeks into it, we had to lay off 4 people because we couldn't afford to keep paying their benefits while they were on furlough. And then 2 people left and went and got other jobs. So that was 7 of our CMAs that we were down. And so it really crippled us coming back. It really crippled us because then when we wanted to bring back our providers, they don't have a CMA now. And so that's a little bit where we are right now. We have a very short, we started seeing people back in June who have 3 or more skin cancers, plus all the other stuff we were doing during May. But now we have a very big shortage of MAs. We brought 1 PA back last week, and we're planning on bringing another one back in July. But we're all working more than we normally work hours with less helper staff. So it is quite a bit of a burnout situation. The people who we furloughed and then had to lay off were the people who did not want to come back. Like we asked for people to come back and they made excuses about not coming back. And so that's why we laid them off. But like Cindy was saying, it's created a morale issue because there are definitely the people who volunteered are like, hey, this whole time we've been making less money. And so it was just going to be kind of a bad thing for the office culture. So then on top of all of that, last week my medical partner said that he's moving his practice down to Charlotte and leaving by the first week of August. So now we're trying to figure out what we're going to do with all those thousands of patients and like try to hire MAs and, have our couple PAs working. So yeah, financially, it's been devastating. It's been difficult for staff morale. We're all working really, really, really hard for less pay because all the physicians in our group took a 25% pay cut immediately. And so at least we didn't have to miss a paycheck. We had to go down. But then the PAs all had to stop working and go on furlough, and that was hard for them because several of them are the only breadwinner in the family. I don't know if we would have done anything differently in a sense because financially we were really hard hit. I might have tried to hang on to a few more MAs just for a few more weeks rather than laying them off and just keep paying their benefits. But I don't know. That's one of those questions you only can look back at and say, like, I don't know if it was the right decision or not, but that's what we did.
Yeah. Well, there's a lot of common themes in between the four of you, which is unfortunately interesting, but very troubling, and hopefully your patient volumes are starting to pick back up. I did want to get into one area about PPE because it's interesting. The North Carolina Medical Society, some of you know, has been distributing some PPE across the state. There was a lot in the press early about PPE and all the shortages. So I'll start with you, Dr. Simon. Have you guys been experiencing the PPE shortage, and what have you done? And hopefully you're on the backside of that.
The first few weeks we were really worried because we thought we were going to run out of masks pretty soon. And so we started right away to use the same surgery mask all day. Mm-hmm. And we started asking patients to wear their own mask into the office. So because at first we were giving away a ton of masks to patients because they would all come in without one. But then we realized if we keep doing that, we're going to run out for ourselves. So then we just started telling them wear anything you can wear, a cloth mask. We bought a bunch of bandanas and we gave them away to people who came in without one. And then we somehow were able to make it through just by conserving like that. We never ran out of gloves. We were able to get Cavi wipes. And so now at this point, we're okay with our PPE. We're starting to wear full face shields because there looks like some research that might be more protective than masks. But we're now like continuously ordering masks and basically hoarding them for the winter.
Yeah.
Stockpiling.
Stockpiling. As a follow-up, do you guys as a practice have a mask policy for your patients as they're coming in? You mentioned that you were giving away masks and you stopped doing that because you realized it was creating a deficit for you guys, and then bandanas. So have you adopted now a policy for your patients coming into the office?
They are all required to wear a face covering. If they're not going to, then I volunteer to find them a different dermatologist.
Mm-hmm.
I have asthma. My husband's had multiple lung surgeries, and I'm just not okay with people putting our staff at risk by just not wanting to wear a mask.
Sure.
So
yeah.
we bought bandanas, and we allowed them to make a $1 donation to charity in order to take a bandana. So we wouldn't make them feel like they were, having to buy it from us.
Mm-hmm.
Actually, that's worked well because people have donated like $125 to charity so far. But that way everyone has a face covering. People are not arguing with us anymore. They get 3 text messages, you have to wear a mask, and nobody's giving us a hard time with it.
That's great. I think we have a chat box question. Aubrey, are you on the line, and can you read the chat box question?
Yes, sir, I am. And the chat box question is, are there any changes you've made that you feel have been helpful and you would want to keep going long term?
Amanda, why don't we come to you for that one?
I believe the first thing that comes to mind in that is definitely the telehealth. That has been very helpful. First, in reducing traffic in the office, Second, in helping patients still feel like they're getting the care that they need and not having to leave their home if they're uncomfortable doing so. And it's also allowed us to spread out the use of our rooms more. So definitely telehealth is something I want to see continue to, I want to see it continue no matter what. That's probably the biggest thing.
Mm-hmm. Cindy, how about you? What would you keep? You're here
me?
now.
Okay.
Yeah.
Okay. So we're with Amanda. Our physicians love telehealth, and if it could continue, especially for our 2-week postpartum new checks on our patients, they love that. They love any of our anxiety, depressions that they can actually talk to over the phone. If that could continue for quite a while, that has been a huge benefit to the practice. We also put in plexiglass at our checkout areas, and I think that I've made it so that it could be temporary, but I think going forward, I would like to keep that going. One, we're going to run right into the flu season. I love the fact that we see sick patients in a whole different area, and it doesn't expose our staff or the other patients to the sick patients. So that's something that we will probably continue to see how long we can actually do that, especially, again, since flu season is right around the corner, it seems like. But those are a few things. But, again, telehealth, that would be a big plus to keep for the practices.
All right. Michael, how about you?
There he is.
There we go.
Okay.
I'm sorry. One thing I would do is learn how to use Zoom better. I couldn't get it unmuted. So yeah, certainly telemedicine has been an important, and I'm sure will remain as an important way that we deliver care. Especially been helpful in our remoter parts of the counties, and our behavioral health specialists have found that they're having much stronger compliance, less no-shows, etc., with the advent of telehealth. I agree completely with Cindy's comment about the enclosures that we have put up. We will not be removing those. I think those have been important infection control barriers that make sense. We may continue the mask policy for a long, long time. It seems to me that we have cut down on the spread of other kinds of, disease spread, flu, etc., by what we've done. Car check-in was always a part of our practice but a much smaller percentage of our patients wanted to do car check-in. Now I believe that we will probably convert parts of our waiting room into patient care and maybe some counseling and office space, and probably will never have to return to the size of waiting room that we have utilized in the past. We will always keep a supply of PPE now. So one of the things that we were not as fully prepared for was the immediate need for this much PPE equipment, and we did all the same things as far as trying to economize. We had to ignore CDC guidelines for a while and use our own common sense in order to reduce the usage and still feel like we provided adequate protection. I think that we're well aligned now. We do have some providers with their own compromised health, and they're not comfortable now and may never be comfortable seeing sick patients without a full PAPR. And so that may be a permanent part of the way they deliver care. Not something they're particularly excited about, frankly. And so those are, and then I think a nest egg, we got lucky. We do have a classic, practice plan where we provide periodic distributions to our doctors. And we had not made our first quarter distribution when this hit. Had it hit a month later, we would have been in much worse shape in terms of our cash on hand. So we got lucky. And and had an adequate surplus of cash to be able to help weather some of this up and down, mostly down. And so I think that we will be even more conservative in the future in terms of how we view that we're ready for a distribution.
Okay, super. Tina, I think you've got a question, don't you?
Well, I actually wanted to, as I listened to all four of you talk, I wanted to kind of go back and revisit something that Dr. Simon raised about the patient not wanting to wear a mask. And I'm curious to hear what the experience are in the other practices, because this is actually something that came up in another Power Hour session we did, and was, not heatedly debated, but we discussed. So I'm kind of like interested and curious in how you've approached that and what you put in place in order to address, the patient. I know Dr. Simon, what she does, but Michael, would you want to take a first go on that one, since you're unmuted?
Sure. Yeah. Thank you. I have had to try to provide some scripting to our front desk staff, who are the ones who are first asked to stop any family member. Typically, it's not usually the children that are protesting, it's the parents in our case. And it does feel like it is a bit of a political statement more than an awareness of the epidemiology of the pandemic. And, we're just not tolerating it, frankly. We can't. There's too much risk. We've gone to great lengths to keep the interior of our building as clean as possible. And we're not going to let somebody make a political statement by not wearing a mask and then come into the building. So we're taking a fairly hard line on it, because for everyone we would let in, we're probably angering 50 other patients and families because they don't want to come into our building now. And most people are pretty rational and are being very considerate of others as well as their own family's needs. So we're taking a hard line. And yes, we've made some people angry because we didn't support their politics.
So have you had to turn some patients away?
Yes. But it's, I would say, on count now over the 3 months into this, maybe two to three.
Okay. Yeah. Okay. Amanda, what about Hickory? How have you encountered any of these situations, and how you address them?
Like Michael said, we just had to take a hard line with it. One of the challenges we have in the OB practice, and I know Cindy can echo this, is they always want to bring their family with them. And so we also had to reduce the amount of the number of people we would allow with the OB patients, and that has caused some problems as much as anything. So we did allow a spouse or significant other or parent to accompany the OB patients if necessary. But on the other side, on the non-OB side, essentially unless the patient required a caregiver to be present with them, they could not bring anybody else in with them. If they have children, we ask that they find childcare, and if they can't, we'll reschedule them. Like Michael, we've only had maybe a couple of people in the very beginning that fussed a little about the mask. We've had older patients, which is really kind of interesting, who fussed about masks, but we just explained to them that, your options are to schedule a telehealth, wear a mask, or we will move your appointment out, to a date that you're more, to a date you're either comfortable doing telehealth or wearing a mask, because we don't know when this is going to end. That's all we can do. So it hasn't been terrible. I think it's gone on for so long now. And we were able to begin talking with patients early on about, please bring something in with you, a face covering, scarf, bandana, whatever you have. We sold masks in the office. We didn't make a profit on them. We had people in the area who were making them, and so we just sold them for whatever they were charging. Typically $5 or $6 wasn't much. And then, is there anything else? That's pretty much it. I mean, we were able to we were able to get by. Nobody has complained incessantly about it. So I think we've been pretty fortunate in that regard.
It sounds like it, yeah. Cindy, what about, you mentioned before your patients are angry. Does that anger translate to mask wearing at all?
No,
or?
ma'am. No, ma'am, not with masks. It's wait time. We had a large community outpouring of Quilters Guild that made a lot of masks for the community. So I take them home probably every 2 days and wash masks and sanitize them and bring them back. So patients are told we have a huge sign on our front door that tells them, stay in your car, call this number, wear your mask when you enter. We also put it on social media. We do, on our appointments, we tell everybody they have to come in with a mask. If they don't have one, we will provide one for them. So as soon as they walk in, if they do not have a mask, they're given one to put on, and then when they leave, they're asked to leave it with us. And we've not had anyone complain at all about having to wear a mask. Our staff, they're not complaining at all. Patients have been very responsive to this, and they understand. We're like Amanda too. We only let one support person come in, and that's it with our obstetrics, with our obstetrical patients. And we reiterate that that's what the hospital policy is as well too. So everyone around the area is following pretty much the same policy.
So that sounds like there's like a few different ways of approaching it. So that's from, providing a mask, or like they do in Morrisville Center of Dermatology with donating the proceedings for the bandana to something. So that's helpful, I think. Franklin, do you want to go ahead? And I have a last question, but I'm going to wait a little bit on that one.
Okay. You guys are all independent practices in different specialties, but you and Cindy, you and Amanda are OBs, and you're also part of a bigger MSO arrangement, which is Unified Women's, right? Multi-state MSO. So I'm wondering if, being part of that organization, if they have offered any guidance to you guys over the course of this, and whether you've been able to put it to use. Cindy, can you take that?
Well, I have to select my words very carefully, right, Amanda? They were delayed in getting information out to us. The smaller practice managers group was ahead of the process and put out information before we actually received it from the higher up. Unemployment information was weeks behind getting it to our employees to be able to file correctly. So we had a lot of issues with unemployment being filed incorrectly. I think they have learned some lessons from this, that they need to be more proactive in getting information to our organizations, but a lot of us figured it out before they sent it to us. Am I right, Amanda?
Yes, ma'am. That is correct. And I'll just echo what you said earlier, that I feel so blessed to be in a group where we talk pretty frequently, and we are able to, because you can't think of everything. And so for us to be able to bounce that information off of each other and make those decisions that needed to be made immediately was made much easier, just because the groups were able to interact with each other and talk to each other about, what are you doing and how are you handling this? So I think it helped all of us in that respect. The one thing I will say, as far as being a part of the big group, I believe that what was more difficult is we did not qualify for the CARES Act loans. So when it came to making financial cuts, that all was decisions that we had to make on the practice level, and we had to make those decisions really quickly, and they were very drastic because we did not receive any relief. So that actually hurt us in the long run.
That's very interesting. So Dr. Simon, I want to ask you, again, you're an independent practice, you're down in the Mooresville area, but you're probably part of the Dermatology Association, right? And I'm wondering if any guidance filtered down to you throughout this time.
Well, I'm also part of a multi-specialty group called Piedmont Healthcare. So
Okay.
we had weekly coronavirus meetings where 100 practice managers from the entire group were on the call. It was like a live WebEx call. So that was really helpful. That disseminated information to the entire group about everything from how to do your telehealth, how to bill for the telehealth, how to have people wait in the car, how to use the push texting from the check-in pads. So like we essentially turned to a touchless check-in. So, but all the offices were getting the same information. So that was really helpful. That went on for 2 months, a weekly call. And then we also got from the American Academy of Dermatology, they were really good as far as disseminating information to the entire group all over the United States as far as like what to do with patients on biologics, which are like the shots that we give people for psoriasis and they're immunosuppressive. You know, which ones people could stay on, which ones were more dangerous with coronavirus, what to do with a patient on those drugs, how far out you could, you know, push a surgery for this or that type of skin cancer. So I do feel like even though we didn't always agree with everything they said, they did provide a lot of guidelines that were easily accessible.
Super. And finally, Michael, again, I know you're part of NC Ped Society. Was there anything that they were able to inform you guys with over the period of this pandemic?
Yeah, I would just like to mention several strategic partnerships. And I can't emphasize enough, our first and most strategic partnerships in the earliest weeks were our housekeepers, our fix-it man, who could make the facility changes, our accountant, who helped me project cash flows and make early application for a PPP loan, and the American Academy of Pediatric North Carolina chapter was outstanding in the immediate dissemination of shared information across the listserv on how people were responding, what to look out for, how to get an application in on a PPP, et cetera, et cetera. And that continues to this day to be a lifeline for me and many of those who are in the pediatric world. We also got some nice support from our AHEC, our local AHEC, as well as MGMA, which I'm a member of, been a lifetime member, and they've been quite helpful. Frankly, there was really little help from our ACO. That's the other important strategic partnership. Mission Health has provided little or no support during this process.
It's disappointing. Tina, do you have one more question for our panelists? Did I lose Tina?
No, I'm here. I'm sorry. I was trying to, there is a little trick you can do in Zoom when you hit your space bar and you just unmute yourself while you're talking, and I was trying to do that and it didn't work. So do it, you know, apparently you can, it's a one-off on that one. I had a question to all four of you with regards to, and it might be a really big question, and I'm so sorry because we're coming up on time, but you all mentioned culture and dynamics of the practice, and, you know, that it has changed, providers are tired, staff is probably tired too, etc. And I know, Cindy, you mentioned a few things that you're trying to do, and like, you know, provide ice cream and pizza and candy, like some fun stuff to keep morale up and stuff like that. But I wanted to hear a little bit from the rest of you as well, what your thoughts are. What do you see happening in your practices, and how are you addressing those things? And again, it's a big question, so I apologize. It's going to have to be a little brief, but I was just curious to hear what your thoughts are. Oh, and feel free. So sorry, I just kind of like left it. So Amanda, do you want to take a stab first? Yeah, I saw you nodding, so that's why I'm thinking maybe you want to.
Sure. I wish I could say I was as proactive as Cindy has been. Some of the fun stuff that we have done in the past, we've always celebrated birthdays. Our staff gets a gift card and cupcake, and it may not seem like much, but I can tell you after going 2 months without it, our Able and babies were very happy to get a little boost We are working on Employee Appreciation Day. It's really kind of weird to try to figure out how to make that happen when the environment is so unknown at this point. But I have to say that our staff, if I could hug every one of them, I probably would, especially those that did not furlough and actually worked their 1 week on and 1 week off. I've heard very, very few complaints from the staff. They have really stuck in there. I think they support each other really well. They have found a way just to persevere through all of this and just keep going. And I think it's just the support that we provide each other that has helped as much as anything. So I'm really amazed at how well they have hung in there and complained very little.
So I think that leaves me. I will say that I think we sidestepped some of the culture tension that, as a result of our PPP loan. So I cannot say enough about the value of that loan in terms of taking off the table that that need to furlough. We were not planning to furlough anyone, but we did cut their hours dramatically. And without that PPP loan, they would have stayed in that reduced hours situation. Unemployment's complicated. I've become quite informed about it now. And just because one's eligible for partial unemployment, there are, as you all probably already knew, there's a number of criteria that you still have to meet in order to even get $1 of unemployment through North Carolina. But $1 would get you 600 more from the federal government. So it's quite important that if you're going to apply, that you get at least $1. And so I sidestepped that for 8 weeks. And in that time, we just tried to build our culture. And, you know, people were actually working closer to 24, but being paid, you know, their historic rates. So 32, 33, 34 hours a week. That's never happened before, where people get paid more than what they actually worked. And so I just kept emphasizing, you know, enjoy it while you got it. Let's know that this is our bonus that we're getting. And we're going to have an 8-week period where it's going to feel very different. And, you know, now we're finding that the vast majority of my employees are glad to be employed, and they're into the 6-week, you know, more austere period where we are, they're not going to gain that $600 bonus a week. Just a handful are kind of lingering and having difficulty letting go of that. So I think we'll be fine. I'm really feel badly for those who have lost permanently a chunk of your support staff as a result of this. Like Dr. Simon was saying, sounds devastating. And I'm really thankful to the PPP loan for giving us that bridge that we needed to sidestep that.
Yeah.
Can I add one more thing? I'm sorry. Can I add one more thing that I think that we feel like that we have to do? Was we were just getting ready to do employee evaluations when all of this hit in March. So it had been 6 months before staff had received any feedback of how they were doing, if they were up for a raise that they want at this point. And I think that I'm hoping that that's going to be a turning point for us. I do want to reward the people who worked while the others were on furlough. They worked extremely hard with reduced hours. That group never complained. Day 2, and bringing everybody back on furlough, we identified who our problem people were. And unfortunately, I lost my biller after 13 years because of the furlough, and she came back and decided she wanted to go elsewhere. So it has been difficult, and I understand how Dr. Simon feels when you've lost staff. I lost 3 employees who did not come back, and I have 2 that are on the fence that I think that are looking to go someplace else. So it has changed the dynamics, but I do feel like giving them some kind of feedback, some type of evaluation is going to be critical at this point to try to get them back into some type of normal routine here.
Yeah. Dr. Simon, any last very brief comments before we need to wrap up as we're coming out from time?
We did actually promise like the 8 people who we call the COVID task force, which were the people who all stayed to work. You know, we're going to give you a bonus no matter what, come hell or high water at the end of this year. Like even if from my own personal savings, I will give you a bonus. We also we started having a lot more birthday celebrations. We started giving every week at our weekly meetings, we started providing lunch for everyone. Like we bought it for them. We had special lunch boxes made that says Corona Task Force for everyone who was there. My front desk supervisor went around every week and gave everyone a thanks for being here gift, whether it was just like a little like sample or a skincare product or whatever it was very nice and sweet and just a little thank you. And then just the people who are here and who have made it through, I feel like we have all become a lot more solidarity, just knowing that you've made it through this together. You know, we feel like much more close. So that part's been good.
Awesome. Thank you so much. Franklin?
Yeah, I just want to close up, say thanks to the panel today. You guys have been, you've been to war with this COVID-19, and you guys have innovated and really made do with a lot less resources than you usually have. My hat's off to you guys. Keep up the good work, and thank you for being part of today's Power Hour.
Thank you for the invitation.
Thank you for
You're
that
welcome.
opportunity.
Thank you all so much. Thank you to our guests. Thank you to our participants. This wraps up this week's Power Hour. We hope to join us next again. A big thank you to our guests. Thank you so much for everything that you do to keep our people safe. Thank you, and have a nice weekend.
Thank you.
Thank you. Bye-bye.